Welcome to On the Beat. I'm sitting here today with Dr. Ricky Johnston and Richard Hurd from Gastroenterology Associates of Columbus and Starkville. And this is a topic we're talking about today I don't think a lot of people have heard about, and I'm going to have you say it, but it is called C. diff.
That's right. C. diff is short for Clostridium difficile.
See why I had you say that.
Sure.
And what is C. diff?
C. diff is a bacteria that is very common, and probably it's more common than people realize, but it's a bacterial infection that we can pick up, and that can cause some pretty major gastrointestinal symptoms.
What are some of those symptoms?
Mostly it's abdominal pain and diarrhea.
Okay.
Some bleeding can go along with that as well.
And is this something I can catch from other people in the house, or is there a way to avoid it?
You can catch it from other people in the house. Generally, though, people catch it after, or not catch it, but develop symptoms from it after they've taken antibiotics. You take antibiotics to treat a sinus infection or bronchitis or pneumonia or whatever. And when you take antibiotic, we sometimes refer to them as like the shotgun effect. You're not, shooting or killing just that one bacteria. You're really killing a lot of bacteria in your entire intestinal tract, or your body, but in particular intestinal tract. So you knock off some of the good bacteria in your gut. C. diff, if it's there, doesn't have any competing factors anymore, and it can grow really crazy out of whack and create all these symptoms and get people in a bad way.
You're right, I don't think about that. It's not just attacking the one issue I am taking the antibiotic for.
That's right.
So what is the cure if I'm diagnosed with C. diff?
Ironically, it's an antibiotic generally.
Another one.
Yeah, right. Yeah, but no, these antibiotics that we use generally are very specifically targeted to C. diff. A lot of them don't even act anywhere outside of our gut, and it doesn't necessarily get those good bacteria as much, but mostly we're trying to get rid of that C. diff and kill all of that with those antibiotics.
Now, one thing that you just made me all think about is a lot of those symptoms, and you've said this before, are the same of other issues that somebody can have. All the more reason to come see you.
Yeah, that's why Google's a blessing and a curse.
Yes.
People plug their symptoms in, and it could be 1,000 different things. But yeah, exactly. There's so many different things it could be. That's why it's important to see your healthcare provider when you have anything kind of out of the ordinary.
And we don't have to beg people to do that with C. diff. I mean, they are like, people are coming to us going, there's a problem. What is going on here? Help me figure this out.
And it can be severe. I mean, we used to think of C. diff as more of a disease or infection you would get in the hospital. People who are in the hospital with bad sepsis and they're on antibiotics and they would get C. diff there. But we're seeing a lot more of it community kind of acquired or developed now for people who take antibiotics at home and develop this. But it can be, mild, but it can be very severe too. I mean, you can develop something called toxic megacolon, where your colon basically quits working and gets swollen and can be at threat of rupturing. And if it's severe enough, it could require an emergent operation.
So that could be very dangerous.
Oh, yes.
Is there a certain age group that this affects?
The older you are, the more at risk you are for it, but no, it can affect anybody.
Okay. And then also to other recommendations you would have if somebody is feeling these symptoms, or like you said, you're going to know it.
Yeah, you're going to come in and get checked out, so don't worry about that. One other thing to mention is there are several new treatments that help give you some more of that intestinal bacteria to help fight off the C. diff. They're very effective. It's called fecal transplant. You might not want to Google that, but it's amazing what it can do and how effective it is.
But a great treatment for somebody suffering with this.
Sure, yeah.
Wonderful. And if you'd like to talk to the doctors, the information is on your screen. Thanks for watching On the Beat.